Well, sorry for the delay, everyone. Thank you for being patient. Good afternoon, everyone, and of course, thank you for being here today. I'm RJ Sigurdson, Minister of Agriculture and Irrigation for the province of Alberta. Now, I'm here today because Alberta's government is concerned about a federal bill that is now before the Senate. From an agricultural perspective, Bill C-293, an act respecting pandemic prevention and preparedness, encroaches on our constitutional jurisdiction under Section 95 and singles out the animal agricultural and food industry if we face another pandemic. These proposed changes could devastate Alberta's agricultural industry and have huge negative consequences on producers, processors, and our entire provincial economy. If the bill passes through the Senate, the federal government would have the discretionary power to allow public health officials to shut down facilities like livestock operations and meat processing plants without clear, objective criteria. This would disrupt meat supply chains and other agricultural operations linked to them, like feed production, which would place our role as a major food supplier at risk, threatening overall global food security. One of my main concerns is that the bill proposes to regulate and possibly phase out some farming practices that public health officials believe could propagate a pandemic. This could alter farm and ranch operations, affect producer and processor livelihoods, and impact our economic stability for the worse. I've sent a letter to our senators and the Minister of Agriculture and Agri-Food Canada and Health Canada to express our concerns about Bill C-293. I've asked that the Senate consider amendments so we can avoid any unintended consequences. Canada already has legislation, animal disease surveillance and action plans to make sure our farm food safety and biosecurity programs reduce the risks of diseases that can move from animals to humans. We admit that we need to learn from previous experiences, and Alberta supports pandemic preparedness based on science. But we will always stand up for our industry leaders when policies inappropriately threaten their viability, and we will always stand up for our constitutional jurisdiction. Our agricultural industry is not only one of Alberta's most important economic drivers, it also forms part of the very fiber of our province's history and culture. As Minister of Agriculture, it is my duty, but also my honor, to advocate on behalf of Alberta farmers and ranchers by pushing back against policies passed by other jurisdictions that threaten the ag sector. I call upon Canada's Senate to reconsider this bill in its current form, to work with Alberta and our industry members to make changes to the bill. As this bill has public health implications, I'd like to now invite my colleague, Minister LaGrange from Health, to provide some additional remarks. She is joining us by video conference today. Please go ahead, Minister LaGrange.
Thank you, Minister Sigurdson, and good afternoon, everyone, and thank you for joining us today. We are here today to speak to the federal government's Bill C-293, an act respecting pandemic prevention and preparedness. Despite a lack of consultation with provinces and territories, the bill is now before the Senate, and Albertans should be concerned. The bill seeks to prevent the risk of and prepare for future pandemics through a national plan. The health and well-being of Albertans is our top priority. There is no argument that governments are responsible to prepare for their jurisdictions for public emergencies, including pandemics. All preparedness plans, however, are unique to each province and territory. They are responsive to the needs of their citizens, their well-being, and their livelihoods. These jurisdictional plans do not preclude the necessity of collaboration between all levels of government when it makes sense to do so. For example, efforts such as maintaining stockpiles of vaccines or personal protective equipment to ensure equitable distribution across the country, strengthening domestic manufacturing capacity, and enhancing support for public health and primary care systems certainly is ways that could be accomplished. However, the federal Bill C-293, Pandemic Prevention and Preparedness Act, raises notable jurisdictional concerns, particularly in how it outlines the federal government's approach to pandemic risk reduction. The bill proposes that the federal Minister of Health will, and I quote, prevent the risk of future pandemics, unquote. The list of measures that could be taken under such a law is limitless. As is the case with many of the federal government's bills, not only are they an overreach of jurisdiction and create redundancies of resources, but the loose language is open to dangerous interpretation and misuse of political and administrative powers during vulnerable times. Bill C-293 also introduces mitigation strategies that may not align with local health data and do not adequately reflect specific regional needs. Provinces and territories have exclusive jurisdiction over the planning, organizing, and management of our healthcare systems, including our response to public health emergencies. We have all witnessed the devastating impact of a pandemic and what it can do on our public health system, the economy, and the agricultural industry. It is crucial to create plans that minimize the effects of future pandemics for everyone. However, these plans must take into account the unique challenges faced by each jurisdiction. Alberta will make decisions about responding to public health emergencies in a way that best serves Albertans, not the federal government. If the federal government is intent to protect the health of Canadians, they can do so by providing adequate, predictable, and sustainable healthcare funding to the jurisdictions that have sole autonomy over their healthcare systems. What we need is a permanent and meaningful increase to the Canada Health Transfer so provinces can put strategies in place to protect and improve healthcare for their residents each and every day. However, Alberta expects the federal government to have meaningful engagement with the provinces before any national pandemic prevention and preparedness plan is developed. We strongly urge the Senate to thoroughly, and I mean thoroughly, review Bill C-293 and incorporate provisions for jurisdictional differences. This will help ensure a balanced and effective national response while preventing federal requirements from conflicting with provincial priorities or existing public health measures that are already in place in Alberta. With that, thank you, and I'll turn it back over to you, Minister Sigurdson.
Thank you, Minister LaGrange. Key Canadian agricultural organizations representing the province's agricultural sectors are echoing Alberta's concerns about this bill. And I've invited some representatives from some of our Alberta producer groups to say a few words today in relation to C-293. We have David Hyink from Alberta Chicken Producers, Doug Roxburgh from Alberta Beef Producers, and Sandra Spruit from Alberta Pork. First, I'd like to invite David to the podium.
Well, thank you, Minister Sigurdson, for your time and support for our farmers on concerns surrounding Bill C-293. We appreciate your leadership and advocacy on this topic. I'm chair of Alberta Chicken Producers, and I represent Alberta's chicken farming families, but this bill also affects our whole value chain. Our Alberta family farms are committed to producing safe, high-quality chicken while maintaining the highest standards of biosecurity. We support pandemic preparedness, but Bill C-293 unfairly targets animal agriculture and could potentially threaten the livelihoods of our farm families. We are asking that the federal government to ensure this bill is amended so farmers can continue to feed Canadians without facing unnecessary risks and restrictions. Alberta's chicken farm families follow strict biosecurity and animal welfare standards under the Raised by a Canadian Farmer on-farm food safety program, which is recognized and audited at the federal level. These biosecurity measures protect both animals and public health, ensuring safe production practices. Despite this, the bill overlooks these protections and instead imposes additional and unnecessary regulatory burdens on our farmers. In addition, Chicken Farmers of Canada, our national organization for the farmers, has been recognized by the International Poultry Council as being a global leader in the implementation of a responsible antibiotic reduction strategy designed to meet consumer expectations and protect the health and welfare of birds. This responsible use strategy works in collaboration with the Canadian government's Pan-Canadian Action Plan on Antimicrobial Resistance and Antimicrobial Use. This strategy has already successfully eliminated the preventative use of Category 1 and 2 antimicrobials, which are the antibiotics of greatest importance to human medicine, as verified by the Canadian government's antibiotic surveillance program. Chicken farming is vital to Alberta's rural economy and communities. Disruptions caused by overregulation could threaten the livelihoods of thousands of Alberta families, as well as the local supply of chicken for consumers. We urge the federal government to amend the bill to allow for a balanced, science-based approach to pandemic prevention. The bill should also support existing biosecurity and health initiatives, rather than adding redundant regulations. Finally, in closing, Minister Sigurdson, we thank you again for your support. It's critical that Alberta farm families can continue operating without unnecessary restrictions while ensuring Canada remains well prepared for future pandemics. And with that, I'm pleased to turn over the meeting to Doug, who is the Vice Chair of Alberta Beef.
Well, good afternoon. First off, I'd like to thank Minister Sigurdson and Minister LaGrange for the support of Alberta's livestock industry regarding concerns around Bill C-293. Your continued leadership and advocacy are appreciated. Alberta Beef Producers supports emergency prevention and preparedness. We understand the critical need to be ready and ensure the safety and well-being of our communities, our livestock, and our continuity in our food production. While we support the overall objective of Bill C-293, we have significant concerns in its current form. Beyond devastating livestock producers, C-293 indicates a clear bias against livestock industries and contradicts other environmental goals like those around the economy and biodiversity. While delivering high-quality protein, beef producers steward 28 million acres of native grasslands and pasture, essential for many wildlife species. That wildlife includes many species at risk that exist today because of beef producers and their stewardship efforts. Disadvantaging the beef industry could be fatal to those species. Antimicrobial stewardship is important for farmers and ranchers. We need antimicrobials now, in the future, for ourselves, for our families, and for our livestock. We are concerned by Bill C-293's focus on animal agriculture as a driver of antimicrobial resistance, without considering the broader sustainability perspectives that integrates and interconnects health of humans, animals, and the environment. Antimicrobial resistance is a shared challenge for all of us in society, and we should work collaboratively on it. Albertans and Canadians alike are already dealing with soaring cost of living. We are disappointed to see this bill further undermining essential services without clear objective criteria. These clauses have the potential to cause significant disruptions to our industry and the Canadian food security. Bill C-293 will harm Alberta's farmers and ranchers. I urge the Senate to further engage with animal agriculture sectors. Let's work together to refine the language of this bill so it's clear and reflects a fair and balanced approach, one that supports emergency preparedness without unfairly targeting livestock industries. All stakeholders need to be at the table and develop a comprehensive plan that is best for all Canadians. By doing so, we can enhance pandemic preparedness while also safeguarding the vital contributions of animal agriculture to our environment, our food security, and our rural economy. With that, I will hand it over to Sandra Spruit from Alberta Pork.
Good afternoon. I'm Sandra Spruit, hog producer and current board member of Alberta Pork. First of all, I would like to thank both ministers for giving us this opportunity to present. We, as Alberta Pork producers, appreciate the importance of pandemic preparedness and prevention. However, Bill C-293 unfairly targets the livestock industry. It implies that the livestock industry in Canada is not responsible, accountable, and credible. However, we are continuously improving and safeguarding the food supply for Canadians and our global customers. The intent of specific sections of this bill lead one to believe that there are underlying alternatives that go beyond pandemic preparedness and preventions. These sections suggest that excellent strives of our producers and the industry are insufficient. Alberta pork producers have one of the highest standards for food safety, animal care, and traceability in the world, with veterinarian and CFIA oversight, as well as both internal and external auditing processes. We, Alberta pork producers, are the foundation of food safety, food security, food sustainability, and food affordability, which are extremely important to all Canadians. Bill C-293 does not recognize our responsible use of antimicrobials that are controlled by veterinarian prescription, and that we continuously reduce our overall use while improving animal health. Secondly, our globally recognized national food safety, animal care, and biosecurity programs that significantly reduce risk and prevent disease from occurring. Last, the nutritional and affordable value of pork, which is a natural, healthy protein and an important source of essential nutrients and vitamins, versus the assertion that the promotion of plant-based alternative protein is the only acceptable choice to prevent a pandemic. It is critically important to understand the legitimate needs of a pandemic preparedness and prevention plan versus an underlying ideology that targets animal agriculture over the well-being of Canadians. Therefore, we respectfully ask Canadian Senate to carefully consider parts of this private member's bill that will create harm to Canadian farmers and the Canadian food supply. Thank you.
Thank you, everyone. We're now going to open the floor for questions. I will start with the media that's in the room. So if you just want to go up to the mic, introduce yourself and who you're here with. You'll have one question and one follow-up, and then we will move to the phones.
Hello, everyone. I'm Alicia Philberg with CTV News. Thanks for letting me be here. Just wanted to know this, I saw the wording, some of the wording that could be concerning for sure. But this bill, proposed bill, is in its second reading in the Senate and was introduced 2 years ago. Why a press conference now?
The cooperation from the federal government is why now. We need them to come back to the table. We've heard over and over again from our producers, our livestock producers, that there needs to be changes to this bill. The overall impact and investor confidence. We talk about food security and safety, that this doesn't, in our personal opinion, help at all. You've heard the stories from our producers already, the work that they're doing, and also the impact of what this means to Canadians overall on food affordability. So this is why we're coming to the microphone right now, is a call to action to the federal government to come back to the table and work with our livestock producers to make changes. There is no clear objectives. The language within this is extremely dangerous in the fact that there are no clear objectives, that it will have a huge impact on any investment that we see in our agricultural sector here in our country. And we're asking that they come back now so we have the time to be able to make amendments to this bill that reflect the great work that our farmers and ranchers have already done and our producers have done, and to make sure that this does reflect their concerns. Full up.
Do you have a follow-up?
I guess just have you been hearing more from producers now, or you didn't hear anything 2 years ago?
Definitely more now. Anytime a bill gets closer and closer to being fully passed is when you're going to see additional concerns. Our producers are all of our livestock groups across all of Canada, our local provincial representatives have been, they're working constantly every year to be able to talk to senators, MPs, myself as a Minister of Agriculture here in the province. And what has happened is they're not seeing the willingness for changes to this bill, and it's getting very close to being passed. So that's why we're standing here now, to be able to put a call to action to the federal government and senators to come back to the table to make necessary changes that reflect the great work that's been done by our producers in this province, and work with them together hand in hand on this.
Thank you. Anyone else in the room? Okay, we'll now open questions on the line. So operator, can you please put through the first person?
The first question is from Tim Brooke from CTV News. Your line is now open.
Hey, thanks for taking my question. I have something unrelated to the current press conference. It's for the health minister. The current data shows that Albertans here, the numbers are frankly pretty pathetic, both flu and COVID shots. I'm just wondering what you might chalk that up to, and if you're, going to encourage Albertans to get those very important life-saving vaccines.
Well, we certainly have started our campaign as we do every year. Last year we spent about $500,000 on campaigns to reach out to all Albertans and encourage them, if they so choose, to get their vaccines. I would say that has occurred again this year. Really, it has only started. Typically, like every year, we start around the middle of October. Seeing as we're only about a week or so into people getting their vaccines, I would say it's a little premature, but the numbers that we're seeing are fairly encouraging, that we will have similar numbers to last year actually going through and getting their vaccinations.
I just want to correct you there, Health Minister. You mentioned last year there was advertising spend of more than $500,000. That spend has actually been reduced quite dramatically this year by about $90,000. It hovers around $425,000 right now. So are you surprised that the uptake numbers are so low when this government is, at least with advertising spend, sending a message that it's not as important this year to get vaccinated as it was last year or even the year before that?
I would say that's incorrect. In fact, last year we did spend about approximately $500,000. We're early into this year's. We are slated to spend, as you say, over $420,000, and that may increase as time progresses, depending on how things progress. But if I compare it to previous years, which was a fraction of that, I would say that we are, in fact, making sure that we get out to Albertans. Everyone knows every year we have at this time an influx of respiratory virus illnesses. And so it's incumbent on Albertans, every Albertan, to have those conversations with their primary care professionals to determine what is best for themselves and their families. But obviously we're already seeing strong uptake in people booking vaccinations through our portals.
Operator, can you please put through the next caller?
Your next question comes from the line of Jennifer Lee from CBC News. Your line is now open.
Hi, thanks for taking my question. And this is also for Minister LaGrange. The Refugee Health Clinic, Calgary Refugee Health Clinic, is losing its operational funding that it says it's received for about a decade through one of Calgary's primary care networks. And the clinic's medical director says they are actually under threat of having to close their doors, even though they have about 2,500 refugees on their patient roster. The clinic also says it's met with officials in your department to ask for funding from the province so it can stay open, but no funding is coming. I'm wondering, I guess, why won't the province step in this case?
We provide funding to the primary care networks, and so they would then have those contracts and those relationships with those individualized additional clinics that they support. So certainly the funding would be going through the primary care network. Again, this would be a relationship between the primary care network and that particular clinic. So I would encourage them to continue having those conversations with those individuals. I will dig a little further myself on this particular one, but that's typically the way that is supported.
Yeah, thanks. I mean, I guess they've been trying to work through the system for, I think, at least a year, that they've met with officials in your department, and they're facing a situation where 2,500 refugees could be losing their care in a matter of months, and that this could put additional strain on hospitals, on a healthcare system that's already strained. So how do you respond to that? Are you not worried about these newcomers, these vulnerable folks, losing potentially the stabilization care that they've had?
Well, I'm certainly worried about any Albertan and anyone, refugee or otherwise, who comes to Alberta and requires care. We want to make sure that everyone is looked after. But I'm not sure what the relationship is between the primary care network, if they've been funded for this, if they've got other mitigation strategies in place. I'm not familiar with the particulars of this particular case, so I will look into it and see if more can be done. But again, this is a primary care network that has been funding this particular situation, and would need to look at seeing how they're mitigating what's the closure of this, if in fact it is closing. Again, I'll have to go and look into this a little bit deeper to find out what the details are, because maybe there's something more to this situation that we're not aware of.
Thank you, everyone. That's all the time we have today for questions, and that concludes this press conference.